Pandemics are global, but they're also very much about what happens at close range. That can mean anything from where people go for healthcare or what happens to local businesses and social connections. To tell us what that means in Dorchester is the managing editor and publisher of the Dorchester Reporter, Bill Forry. Thank you very much for being with us, Bill.
Thanks, Chris.
And thank you for coming out here. I want to start with your neighborhood because you live in Lower Mills, not too far from the commercial center. What is it like there right now?
Well, the commercial center is pretty quiet. Restaurants have moved to takeout only as required, and some of them are doing that, some of them aren't. But there is foot traffic. In fact, yesterday on the Neponset Greenway and at Pope John Paul Park, I was out walking there, and I was not alone by a long stretch. It was as busy as I've ever seen it, probably busier, because people are working from home. Obviously, the schools are closed. So kids are out on their bikes, parents are out running or biking themselves or walking their dogs. It looked like the Westminster Dog Show out there, to be honest with you, this week. And that's a good thing in one context, right? The mayor has recommended that people get out and take a walk, clear their head. This is a stressful time. And what I saw on faces, because there wasn't a lot of talking, and that's good, people should be keeping their distance. And but I did see people looking happy to be out. A little bit more relaxed, smiling at each other. And I think there is a preparation mentally going on too for what is more, people have described it as this is going to be a marathon, not a sprint, but I think of it more as a siege. And I think people are girding for that. They know that this is going to be a long duration event, or they suspect it will. And so they're taking advantage of being able to go outside and do that. There may be times where we can't do it. And so I think this week people were preparing mentally, obviously making their preparations at home and at work, but also just getting themselves ready.
You're also seeing tents. And start with the one, I guess, closer to where you live at Kearney Hospital. What is going on with that?
Right. So Kearney Hospital is owned by Stewart Healthcare. And on Tuesday morning, Stewart announced that they're making Kearney a dedicated COVID-19 facility. So that means any patients who materialize through the Stewart Healthcare system at hospitals like St. Elizabeth's, Kearney, Good Samaritan in Brockton, and other facilities, if they need acute care, Chris, they're going to be coming to Kearney for those beds and for that treatment. They won't be the only hospital in Boston by any means. There'll be other facilities that are already servicing people with acute condition with COVID, places like Mass General, obviously, BMC. But Kearney will be the one in Dorchester, and it's certainly going to be, for the Stewart Healthcare Center, really a test case in how they're going to manage this as a large healthcare system. The idea behind it is to make Kearney kind of their designated place. There's 159 beds in Kearney. Right now, 11 of those beds are set aside for COVID-19 patients. As of yesterday, they didn't have any yet, but that's going to change. And the tent that's outside at Kearney, and people who drive by on Dorchester Ave will see it. It's a big, bright red tent. It's there to screen people for COVID-19 symptoms before they go in the facility. It will be used for testing as kits come online, and they are testing at Kearney at the moment. And Kearney won't be the only place that's testing. There's going to be testing done all over this region, all over the city, in drive-through fashion and at facilities. But at Kearney, that tent is there for that reason, and also to screen people before they go in the facility. That's also why there's a tent right now at Cobbin Square Health Center. They are screening anybody who comes in the building who's not, who's a visitor, is getting screened for things like temperature, and they're asking them questions about symptoms and where they've been. So these are all kicking in everywhere where there are health centers, and Dorchester happens to have quite a few. We have 8 health centers right in the neighborhood. Mattapan has one as well, and all of them are adopting these new protocols, Chris, really in preparation. We haven't seen the big surge yet, but they suspect that it's coming, and it seems to be materializing elsewhere in the U.S. right now.
Well, what I read about Cobbin Square Health Center in your paper is that they're canceling all their scheduled appointments through April 6th. So the screening is, I guess, it doesn't mean you have to know what you have, but if you think you need some help, you just go through that first.
Yeah, they need to be, they want to prevent people from coming in the door who have symptoms, and obviously from spreading it. They are doing what they call telehealth, where they're talking to patients before they come in. People who don't have urgent care issues are being asked to not come to the health center, not just at Cobbin, but all of the health centers are adopting that policy. Call ahead. If you feel that you have any symptoms, whether or not they're COVID-19 symptoms, you must call ahead to these health centers first to have a pre-screening over the phone, and then they'll give you guidance on what to do next. But the other issue for these health centers, Chris, is that they're not hospitals. They are not equipped to care for somebody with COVID-19. They can diagnose them, but they're not there to put them on special medications or ventilators or any of that stuff. And they have a limited supply of their own protective gear. So they really do have to be cautious on how they deploy right now. And that's what we're seeing them do in real time. Sandra Cotterell, who runs the Cobbin Square Health Center, told me yesterday, this is no longer a day-to-day situation or even an hour, hour to hour, it's minute to minute. They're really adapting on the fly here.
What about Dorchester House? Because their health center is part of a multi-service center. So
Right.
are there other things that they're doing for people right now?
Well, they've pretty much closed most of those other programs like the pool and things like that, the basketball court that's inside. That's going to need to be used for other things, most likely. They do still have a food pantry at Dorchester House that's been moved outside, and it's only open 2 days a week. So they are taking extra precautions there, and they're just like all the other health centers. They're guiding people to talk to them first on the phone, figure out alternative healthcare solutions for the moment that won't bring them on site unless there's urgent care issues.
There was once a time when Dorchester Avenue was mainly bars and car repairs. You have a lot of food enterprises now.
Yeah.
How are they handling this?
We've been spending a lot of time this week, Chris, talking to business owners, especially restaurant and bar owners, about what they're doing. Most of the places are staying open that had already had a takeout capacity. Some of them may not have been the most significant piece of the pie, but that's the only thing they can do right now. So places like the Ice Cream Smith is now serving from a counter right outside, set out outside their door on like a fold-up table, and they are taking orders and they're serving. Ballet, the great banh mi bakery on Dorchester Ave, we talked to them today. They're open and doing takeout. They've always had significant takeout business. The places that are going to suffer more, unfortunately, are places that really weren't geared up to do takeout and have decided that's just not what they do. All of the pubs, pretty much, that only did alcohol, obviously, those aren't going to be open at all. So there's going to be some really severe consequences potentially for a lot of these businesses. But most of them that have that capacity, they're trying, and they're saying it's a day-to-day thing for them at the moment. They'll see how it goes. One example is Cesaria's restaurant on Bowden Street. We talked to them. I talked to their owner this week, who said, look, we're not sure. We're not sure this is going to work. We're going to try it. We're going to exhaust our current supply of perishables. And if it works out and we can manage it, we will. But it's very much an open question.
The need for funeral homes will never stop. But what about the way things are done? What's going to happen with that?
Right. It's sad that we have to talk about it, but we do. And we talked to the people who run Dolan's Funeral Home in Lower Mills, and they've already seen a big change in modified behavior even before this epidemic really hit here, because they're all taking precautions. When there's a wake, people generally aren't coming, or they're coming in very small numbers. Funerals are going to be very different, and they're getting guidelines from the CDC, updated guidelines constantly on how to sanitize, on how to care for the deceased who may or may not have COVID related illnesses that cause their death, but still all precautions are kicking in. So for people on the front lines in that sense, there's going to be a lot more work and a lot more, I think, preparation for that. What could be, we hope it's not, but what could be fatalities in our community.
This is BNN News. We're talking with Bill Forry from the Dorchester Reporter. Bill, among the other changes going on is how you put out a community paper at a time like this, because you need people to go someplace. They got to paste it up or put it together.
Right. Well, so our newsroom is still open. Our business office is closed because we don't want people walking in, as sometimes they do, to place ads or give us information. We've taken some measures there, but we're continuing to operate, Chris. We have reporters working remotely, obviously safely covering community activity, things like the businesses that we're writing about. And on our end, we will continue to publish as long as we can. We feel it's important to put a print product out on the street. We have a lot of readers, especially people, frankly, who are not, a higher risk age group who want information. And it's also important to us, I think, from a morale standpoint. A lot of things are shutting down. It's a very, topsy-turvy time for all of us. We want some continuity. We can do what we do online, but it's very important to us as a business, and it's important to our readership, I think, to document what's happening, to put that information out And we'll continue to do it as long as we can. I'm proud of our team, my colleagues, people like Barbara Langus and Tom Mulvoy, and our news staff as well, who've really been showing up, making it happen. And we're going to continue to do as much as we can. We're going to ask our readers to help us a little bit more by giving us information, to consider taking out a subscription, because like a lot of businesses, we've seen our base kind of hollow out in terms of our revenue. And we kind of make an appeal to our readership to, if you value the news that we're giving you, now's the time to help us out a little bit with a subscription.
Do you ever reflect on the importance of a paper as far as engaging people? Because we can get a lot of things, in flyers passed around and in alerts on our iPhones, but what about getting people to really absorb what you're sending them?
Right, and I think, Mayor Walsh has been talking about this in his press conferences, cautioning people, turn to your trusted news sources that you've used all along. There's a lot of new media. There's a lot of new ways to get information. Some of it's legit and some of it's not. And we are a news organization, as you are, Chris, and your group here, that we vet information, we double check things, we have professional reporters, and we have a track record, and we have a medium to put it out on. I think it's important right now that we keep those things going. I think it's going to be increasingly important over the next few weeks. We want people, and I think the mayor's communicated this well, turn to your trusted sources for information right now and stick with us, because we are going to do our job. We're going to continue to do it, and we really need to all tune into trusted sources right now.
So still weekly in print, but otherwise constantly online, and where should people look for that?
Well, you can find us a few places, but I recommend .news.com, which is our website. Our Twitter handle is very active at .news on Twitter, and you can follow me at Bill Forry as well.
Thank you very much for being with us.
Thanks, Chris.
And stay healthy.
You too.
Bill Forry from the Dorchester Reporter.